Paley Advanced Limb Lengthening Institute. Changing lives, one limb at a time. The Paley Institute at St. Mary's Medical Center is dedicated to improving the lives of children and adults who suffer from rare and complex congenital, developmental, and post-traumatic orthopedic conditions.
What distinguishes the Paley Institute from other limb lengthening surgeons or other limb lengthening centers in the country or around the world is experience. There's no surgeon that has had more personal experience with limb lengthening and deformity correction than myself. There's no surgeon who's developed more procedures that are used by other limb lengthening surgeons than myself. And I think that's the reason that patients come here. Patients want the best, most experienced surgeon to do their surgery.
The Institute offers a wide array of services, including consultation, surgical suites for adults and children, digital diagnostics, specialized on-site physical therapy, and personalized concierge services. Every day, we treat patients with limb discrepancy, limb deformity, congenital deficiencies, skeletal dysplasia and dwarfisms, tumors of the bone, non-unions, joint preservation, and many other rare bone diseases and skeletal abnormalities.
These conditions leave these children with a limb that is deformed or shortened, or problems with their joints such as their ankle, their knee, their hip. 25 years ago when I started in this field, the only treatment available to patients was amputation and prosthetic fitting.
Kelly Lockett is an active and happy child. The Arizona toddler is like every other child her age, with one obvious difference. Her lower right leg is flesh and blood and metal.
Kelly was born with fibular hemimelia, and she was born without a fibula. We went to a lot of doctors from one coast to the other, and we had a number of them said actually to amputate and get a prosthetic limb and put on there, and they said that that was the current way to go, and we didn't feel comfortable with that, and fortunately we met Dr. Paley. And he was really the only one that jumped out at us and said, no problem, we can handle this.
Today, at our center, patients can be treated in essentially all cases with limb lengthening and reconstructive surgery. They have equal leg length when we're done with their treatment. They run, they jump, they can do sports, they can do virtually any activity that a normal child can do.
Going through the process, I learned to be a lot stronger, and definitely made me mature a lot.
It's so different than most medical experiences you would go through. It's really cool to know that people are so dedicated. Her whole life was changed tremendously because she's got her own leg, flesh and blood that she can manage and have feeling with.
Feels good to be done and have equal legs.
The Institute boasts two unique and innovative physicians who care for the specialized needs of patients. Dr. Dror Paley, the medical director of the Paley Institute, is a board-certified, fellowship-trained orthopedic surgeon and is nationally and internationally recognized for his expertise in limb deformity correction and lengthening.
Over the past 25 years, I've had the privilege to treat patients from over 75 different countries. I think this is a testament to the trust and the reputation that we've built up in being able to reconstruct, restore, or preserve limbs, joints, or bones.
Dr. Daniel Prince specializes in orthopedic oncology and has subspecialty training in limb lengthening and deformity correction. This unique combination of fellowship training allows Dr. Prince to not only treat and remove bone tumors, but also reconstruct them with state-of-the-art methods.
Orthopedic oncology really focuses on removing tumors and getting rid of the disease. Orthopedic deformity correction really focuses on putting things back together. My specialty is a unique marriage of the two of them. This really hasn't been done before in the United States.
The new patient process begins before you visit our institute. We get to know you and your needs prior to your first visit.
I know what it's like to go through this, both personally, and I know how hard it can be on families. I talk to parents long before they ever get here. So when they arrive for the first time, I feel like I already know them.
There's a doctor that does the same thing in Manhattan. There's someone that does this in Baltimore. But we chose Dr. Paley because, he brought it here. He was the foundation of this type of surgery. You want to be with the best, so that's why we came.
I want the families of my patients to leave the first consultation with a plan. How many operations it will require to equalize their child's limb length, correct associated joint and bone deformities, and restore the child to normal function.
The Paley Institute's team is committed to meeting each patient's individual needs before, during, and following treatment.
Everyone's been so great. If we had a question, it was immediate. Everything was immediately answered, from the girls behind the desk to the x-rays to Tony and his fixators and the physical therapists and PAs, of course.
You really couldn't turn around without someone asking you, do you need help? Is everything okay? How's it going? Is there any problems? They were just so helpful.
What I've seen in Robert is it's actually made him understand that anything is possible. He can put his mind to it, he can do anything.
When I grow up, I'd like to be a baseball player.
As a patient, I know how important the little things are, whether it's just someone to give you a hug when you're down, whether it's just a smiling face. We really are a patient-centered facility.
We decided to come all the way to America for this treatment because we weren't convinced that the treatment that was being offered elsewhere was the best we could get for her. Our experience here has just been amazing. The whole team has just been so helpful and friendly and made the whole process so easy, I guess, really is the best way to put it. She'll be able to run and play and do what all the other kids do, which is just fantastic.
While patients journey from all over the world in search of real hope, physicians are drawn here to learn how we reconstruct where others amputate, how we preserve where others replace, how we restore function and eliminate disability. For patients requiring surgery, Dr. Paley operates in dedicated surgical suites at St. Mary's Medical Center. This state-of-the-art facility offers a specialized operative environment tailored to the needs of complex orthopedic correction.
We offer the latest in medical imaging technologies, including the most sophisticated low-dose imaging system called the EOS three-dimensional imaging system, which is the first technology that's able to image from head to toe. This has allowed us to better plan our surgical reconstructions.
Dr. Paley was the first North American surgeon to implant the precise limb lengthening nail, a major breakthrough in this field and the most technically advanced procedure available. This internal lengthening mechanism is fully implantable inside the bone and has perfect rate control, going both forwards for lengthening and backwards for shortening. Located in the heart of the Palm Beaches, the Paley Advanced Limb Lengthening Institute at St. Mary's Medical Center offers the most experienced limb lengthening and deformity correction program in the United States and the world.
I loved having my last surgery in West Palm Beach because the shopping, the beach is here, and it's a really fun place to go through everything. There's always something to do, even with the fixator on, there's always fun things to do.
Callahan was born with a skeletal dysplasia called pseudoachondroplasia. When he was diagnosed, it was the most traumatic time our family's ever, and I definitely have ever gone through. We were told basically that there's nothing we really do for these kids. You wait until they can't walk anymore, they become almost immobile before you do anything. And that's really, really hard for a parent to hear. I can't tell you the difference I felt driving home from that appointment with Dr. Paley, because it was the first time anyone had told us we would try to do something. Now, his right leg is completely and totally straight, and all those doubts I had, I just was so happy that we went ahead and did that surgery, and look at the difference it has made in my child.
Here at the Paley Institute, all therapy sessions are one-on-one. We have state-of-the-art equipment. We have direct access to Dr. Paley and the physician's assistants. The patients that we see all have very rare diagnoses, and we may have 5 or 6 of those kids here at one time. It's really quite remarkable. It's really neat to see them bond, and they come here and they see other kids that are very much like them. And it's also fun to see them because they can see kids across the lifespan with that deformity. And the families that are coming in for their very first surgery can't imagine what it could look like at the end. But almost invariably, there's a child here with the same diagnosis that's completing their care.
I was diagnosed with Olliers disease. The rarity of it is about 1 out of every 100,000 people. By the time I was 9 years old, I had a 6-inch difference between my left and right leg. Going through treatment, it wasn't just me at that point, because when you grow up, and I'm the only one that's different, but you come here and everybody's a little bit different, everybody's got their own case, but they're all going through the same thing, the limb lengthenings. So that helped a lot.
Meeting all these people made everything easier because we were all going through it together, so we all understood each other.
Whether you are learning about the Paley Institute for the first time, a long-standing patient, or a health professional, we look forward to helping you and your family.
I think in every way, this is a growing experience for our patients and their families. At the Paley Institute, we're committed to changing lives one limb at a time.